Hello, and welcome to the Behavioral Health News Spotlight on Excellence series, where we feature exceptional leaders and innovative healthcare solutions that are raising the standards of care in the behavioral health community. My name is David Minot, and I am the Executive Director of Mental Health News Education, the nonprofit organization that publishes behavioral health news and autism spectrum news. Our mission is devoted to improving the lives of individuals living with mental illness, substance use disorder, and autism, while also supporting their families and the professional communities that serve them by providing a trusted source of science-based education, information, advocacy, and quality resources in the community. Today, we are speaking with Cassell, Executive Director, and Nadeem Ramjan, Director of Data Strategy and Analytics at Advanced Health Network and Recovery Health Solutions, otherwise known as AHN RHS, operating an affiliation. AHN and RHS work together with the shared goal of improving the health and wellness of individuals experiencing behavioral health disorders, often further complicated by medical and social determinants of health issues. AHN RHS is a network comprised of almost 50 New York State OMH and OASS licensed agencies, providing comprehensive community-based services to individuals and their families experiencing behavioral health issues throughout the 5 boroughs of New York City and Nassau and Suffolk counties in Long Island. Working as a team, Carol and Nadeem have been busy gathering quality metrics data from their member agencies and have worked to put this data in a format that is actionable and visualized so that providers can easily determine where there are opportunities for improvement and where they are doing well. With their impressive visual reports, they're helping providers understand the value of a data-informed culture and its positive impact on the entire care continuum. Carol and Nadeem, thank you so much for being here today.
Thank you. David, we're happy to be here, and I look forward to sharing our learning as we're learning on this journey, and hopefully can share that with others as we go forward here. So
wonderful. So why don't we start out by telling us about the Advanced Health Network and Recovery Health Solutions and the services that are provided.
So we have some slides here to share with you and those who are listening in on who we are. And as shared, our providers represent both mental health, substance use, inpatient, detox, rehab, residential, outpatient recovery programs across the 5 boroughs of New York City and all of Long Island with multiple locations. So close to 50 providers and over 200 locations in several upstate, serving about 50,000 patients annually. And where we've been focused on, we often hear said data is the asset of the future. But what does that mean? Because we all collect a lot of data, whether we collect it through our EMRs, assessments, care plans, but how do we take that data and really transform it into a way that it becomes actionable, measurable to support what we do every day and the competitive advantage that we're looking for as we seek to get paid for the incredible work that our providers provide every single day. So it's an investment. If the data is an asset has to be managed and invested in, and there's investment through cultural change, that cultural change being with people, processes, workflows, and technology itself. And it starts with, and we sometimes take this for granted, it starts with what data we collect, where we collect it, how we collect it, and then how we summarize it in a way that we can then publish it and have it visually actionable so that decision making can occur. And as we've worked with some of our providers, we've discussed how we make it visually usable and actionable at an executive level, at a management level, and at a staff level. It's frustrating to staff when they're collecting data and they don't have an appreciation for how that data is really informing care coordination plans, quality improvement efforts, and the like. So that investment is a significant investment that we've been supporting our providers in. The other piece that we are working on as a data-informed culture is to bring together medical data, mental health data, substance use disorder data, SDOH data, in a way that we, again, can package it, visualize it, and utilize it to inform our quality improvement efforts, our care coordination activities, our contracting, our grants. And we're fortunate, we're emerging with all this data, but making it actionable is where we're focused around. So we have built a robust business intelligence platform that we'll share more of with you. Nadeem has been leading that effort. We've also learned from the healthcare community as a whole that a referral management solution would be helpful. Too often, emergency rooms, hospitals, physicians in the community, they might identify the need, but they don't know where and how to refer. And so we have built a platform that supports that data flow. The other piece, not to be taken lightly, is addressing consent management, because in this space of mental health and substance use, while we all are familiar with HIPAA, there are additional consent requirements because of the nature of the data that we have worked on helping our providers best manage. And then all of it moving towards management of grants, bundled payments, incentive programs, and visualizing the data. So we're working with our providers on quality measures, performance improvement, ad hoc reporting, care coordination, bundled payments, clinical viewers, and we look forward to sharing some of that with you.
That's great. So with that said, why should providers support the transformation to a data-informed culture?
Yeah, so it's their future. Their future is going to be predicated on making informed decisions, focused on certain population cohorts. So as we built the data warehouse, again, bringing in all of this data from these multiple sources, we've been able to define population cohorts in terms of those who have complex needs. Complex needs being a population cohort where they have a medical condition, a mental health, a substance, housing, employment. That requires a different level of care management, care coordination than someone who might just present with a substance use disorder or alcoholism. So building of this data warehouse, we've brought in all this data, we've collected it, we've normalized, we standardized it so that we can, through actual data analytics, look at retroactive practices, what their performance is in meeting HEDIS metrics, what their performance is in 30-day, 60-day, 90-day engagement periods. We've also started to develop comparative analytics so that if you and I are both in the same space, how are you performing versus myself performing, and what shared learning can come from those best practices that we're deploying is measured in the analytics. And we are now also starting to move into predictive analytics because where we can intervene earlier by engaging individuals where they're not presenting repeatedly at the emergency room, that's where we want to get. We really want to focus more on the prevention and the recovery along with just treatment. And again, we're looking at how do we visualize it from looking at cohorts of provider cohort, a population cohort, whether it's individuals who have come out of the justice system or the veterans cohort, because how we engage with these populations are different, and they should be, because we want to be patient-centered, person-focused. And then again, supporting the providers in how we optimize their EMRs in the psyches database that the state provides to our mental health substance use providers. I'm very passionate about that. In my background, I've worked with implementing EMRs in hospitals and primary care physicians and now the behavioral health community. And it's one thing to implement it. It's another step to optimize all the functionality and capabilities that exist in that EMR. So is we're helping our providers and build that data-informed culture. We're actually helping them optimize the investments that they've made in their technology platforms. And then to reiterate, doing it with helping them on their consent management as well.
Wonderful. Can you provide some details on what AHN RHS is doing to support its behavioral health providers?
We're happy to. And Nadeem, you want to take us through some of those areas that we've been helpful with?
Yeah, so we're all quite familiar with the standard HEDIS metrics. What we've tried to do is to kind of peel back the layers and say, okay, well, how can we identify why patients are not adherent on certain metrics? So we have some examples over here, as you can see on the right. And some key things I want to note is that, you know, we want to peel back the layers, we want to get to actionable data, but in doing so, we want to be able to leverage the existing data collection tools. You know, sometimes you find a new project and then we say, okay, well, let's build a survey tool to get that data, or, you know, we take all types of approaches which can create a lot of administrative burden. So one of the strategies we employed is let's try to look at existing data collection tools and squeeze as much value out of them as possible. So on the right here are some metrics we've built internally, which start to tell the true story of which patients we need to focus our attention on. So we have, for example, on the top right, an AMA report where we're able to track patients that don't complete treatment. Below that, we look at patients who are only staying less than 30 days, and we have that in red over here. So then we take this, we drill down with the providers, and we look for the commonalities among the patients that are not staying the minimum 90 days as recommended by various programs. And then lastly, we've built an entire suite of SDOH measures. One of them is here, where we look at patients who, when they come in for treatment, they're unemployed, and by the time they leave, they have some level of employment. So in doing this, we're able to look at some non-traditional data, but utilize the existing data sources that are there to, again, build deeper insights into why certain patients are not, we're not able to move the needle on metrics.
And we have another example to share, which builds upon the psyches reporting that the state has built the infrastructure for, and our providers are working with. Nadeem? Mm-hmm.
Yeah, so over here, we show an example where we have some data that is perhaps dated. It's not as real-time as we'd like it to be. However, it doesn't mean we can't utilize it. And so what we have here is an example of a trended report where we've trended about 2.5 years worth of data. And it tells a really strong story where if the provider, for example, is not improving on a measure over a period of 2 years, then definitely they need to look at some new methods, some new engagement techniques to employ with their populations. And so we trend data over time to show how providers are doing. And also we compare them against their peers. So we do some ranking reports where we rank our mental health outpatient providers against each other, our SCD providers, those that are CCBHCs, those that are inpatient. And so we also rank them with respect to how they're doing on measures compared to their peers. And we do it in a blinded way, so there's no feelings of highlighting people. But also what this data shows is that if you are, for example, the quote unquote worst among your peers, what often is the story is that you are dealing with a far more complex population. So that also helps them as they engage with different grant applications and MCOs that, look, I'm not able to perform as well as my peers because I'm dealing with a much more complex population set. What can I do here? And what help can you offer me so I can improve the care that's being delivered?
And our next example is with population health. And Nadeem, you want to?
Yeah, so we try to empower our providers so that we're giving them data at the PHI level, at the patient level, building registries and so forth. But then we also do work at a population health level, which is really the power of the IPA and the fact that we span such a wide range and have so many locations of providers. So we pull together demographic data, medical data, mental health, substance use, and SDOH. We pull together all this data so we can tell the full story of what's going on with the patients. So they're not just, so we look at clusters. You can see over here we have some examples of some geomapping we've done, and this is really trying to get into this relatively, it's not a new space, but it's a space that's getting more attention now, which is to be more neighborhood focused. And so a lot of grants that are coming out now, they ask you to focus on a collection of contiguous zip codes in a specific region. And so we drill down on that and we say, okay, these folks, they have high rates of diabetes. They also have high unemployment rates. and they also suffer from depression. So we are able to combine all this data so we understand the population. And then on the lower right, we try to make sure that we're also being culturally sensitive. So we look at data both public and internal to see what are the what's the ancestry of the folks in those regions, so that again we're being culturally sensitive. So this is an example where we try to pull all the data together in one place, put it together in one presentation, so that as we're applying for grants or for targeting populations, we see all the factors that are affecting people in a specific region. Because certainly a patient in the South Bronx, they would have a different mix than a different set of needs than one perhaps in Western Suffolk. And that's exactly what we find as we do these types of analyses.
And the next example to your question, David, on where we are utilizing these analytics is we are pleased to share that we have initiated a pilot project with another plan, Health First, called Walk With Me. It's a medication-assisted treatment program. We spent about 3 years developing a clinical model, and we have built a program that embraces a patient-centered approach that captures data for what's termed wraparound or add-on services. Those are services that are not billable today, but are means of having better engagement of the individual in the program. And so it's a pilot program to test how this bundled payment approach supports a clinical model, all supported by data that gets captured, gets gathered, summarized, and we're just rolling it out. So we anticipate in about a year, we'll have sufficient data to be able to have learnings from that we can then modify this program as we go forward.
Wonderful.
So to sort of summarize the work we do in terms of supporting our providers, we've spent a significant amount of time on consent management. And one of our guiding principles we have is trying to make sure we find solutions that don't create administrative burden for both our providers as well as the patient. And so we've leveraged existing consents that have been well vetted within New York State, and we've trained our providers through a series of webinars on how to implement those consents, also helping them build scripts so they can clearly communicate what the patient is consenting to. And so that's been a great success, I would say. And there's no conversation we have about improving care that doesn't involve consent. So that's something that you really have to have a clear strategy and focus around if you want to help improve patient care and to break down barriers with data silos. In terms of quality management and reporting, we've shown some examples of some reports that we've created, and we do it at the population health level as well as at the provider level, and we share performance reporting with our providers on a quarterly basis so they can look at how they're doing and if they're adhering to goals with respect to different grants that they're part of. Data visualization, similarly, we leverage existing tools that are available at the state level, as well as creating visualizations on an ad hoc basis to again support the management of various grants. We look to optimize their use of the EMR. Across our IPA, we have 15 different EMRs, and we work with all of our providers to help them make sure that they're making the use of the data that is there. So that leads to a lot of shared learnings, because as we become experts in different EMRs, we're able to show our providers, hey, you can look, if you can use these 2 or 3 reports and basically answer 80% of the questions you have. And again, as we also have this wide network of MH and SUD, we were able to come together, form work groups around specific initiatives, using learnings from specific providers and then sharing it across the board so everyone in the IPA benefits. And lastly, we are working towards this goal, which is it's a goal for everyone in data and in healthcare to break down silos and to have interoperability. So we have strategic partnerships with specific vendors that we've hired in the IPA that will support interoperability, so that if a patient goes from the outpatient setting to the residential setting, the outpatient provider can see which meds their patients are receiving. So we break down those barriers, again, leveraging our vendor relationships and strategic partnerships so that we can have data flowing between providers, even if they have different EMRs. And I think that's really critical, because sometimes, it's easy to focus on data visualization, but at the same time, sometimes providers just want to know a simple one-line statement in their EMR. Did the patient pick up their med, or what meds were they prescribed? And so we support that as well to, again, have better patient care, break down silos, and hopefully see, better outcomes for our patients.
You are certainly doing a lot to support providers. They are lucky to have you. So what have you learned throughout this journey?
Yeah, that's a great question, because it is a journey. Without a doubt, it's a journey. And as I shared in my opening comments, we all think that we have data, and that data is just magically going to transform itself into these reporting capabilities that's going to help us in our day-to-day management, our strategic leadership, and it's not that easy. And what we've learned, or what we've confirmed, is that the build of a data warehouse is a journey. All this data coming in needs to be normalized and standardized, and it takes time to do that. We've also learned that in the build of the data warehouse, not everyone captures data in the same way, or how you might capture data and I might capture data could be very different. I might ask questions very thoroughly and capture a lot of data points, and my colleague may not. So the data capture it's an operational investment that really requires orientation, education of the workforce in terms of why it's important, how it's going to be used, and then the investment in the infrastructure itself. Now, that being said, there's a lot of data that gets captured, and what we've learned and what we've had to do through our shared learning with our providers is to prioritize and focus on what matters. What we don't want to do, as the cliche goes, is be managed by the data, but rather manage the data, so that we are prioritizing and focusing on those key data points and data elements that, when made actionable, will help contribute to improvement in care, improvement in quality, and support the ongoing funding that's needed to make the investments in the interventions and the workflows and the processes, the resourcing and the technology that's required. In the end, what we're about is improving the lives of those that mental health and substance use services are being provided to. And so Nadeem might want to add on this. That's the summary of it's a journey. It's an investment in people, in technology, in workflow, in infrastructure. It is a change of culture to be data-informed, data-driven, where we manage the data going forward.
Yeah, I think it's well said. It's really a journey, and we're so happy with the partnership we have with our providers. We always try to meet them wherever they are, and remain focused on what we can achieve today, rather than focusing on something that's going to take years and years. So taking a phased approach, I think, is critical when it comes to data, and we've been able to lay that out through all the collaboration we have with our providers, and just making sure we're listening to what they're saying, and just getting them the greatest value for the data, making sure we're not just producing data for the sake of dashboards, but making data that's actionable, relevant, and again, barrier-free, where we're not creating burden for them. We're doing whatever we can today, and then laying out a path for the future for things that are much needed, like interoperability.
I would add to that also how we format, how we put the visualizations together. We take it out, we'll get feedback, and we get their input. We get their input in terms of what metrics matter, what data matters. So it's a collaborative, shared learning and development culture that we are building. And because of that, I would be remiss. It really comes down to trust at the end. There's a lot of questions about, can we trust the data? And that trust comes from the engagement with the leadership of the organization, their input, their feedback on what's important and how we make it available. The trust with the workforce, from those who are collecting the data and learning how that data is being used, to management, trusting the data, and in a data-informed, culturally driven organization, it's making data a part of almost every meeting, how it's being used and worked with. And then the processes, how is the data captured? At what level of detail is it captured? And then as those processes are defined, it's looking at the technology, and I'm very passionate about it. It's the enabling technology that supports capture of the right data at the right time by those who are most skilled to capture that data so that it can then be gathered, summarized, visualized in a way that leadership can lead the culture of the organization to be data-informed, data-driven, and demonstrate that to those external partners that we are the quality-driven provider, in our case, AHN RHS network, that services want to be provided at and be received from.
Well, thank you. So this has been very informative, and I had no idea that so much was being done with data to help these provider agencies improve their services and improve outcomes. So it's really wonderful what you guys are doing. Thank you both so much for your time today to share your impressive work with behavioral health news readership.
And thank you for the opportunity of sharing this story, because data is something that we all need to make an investment in, learn from, grow with, and share with each other. So we thank you for the opportunity to share our story today. Absolutely.
For more information about the work Carol and Nadeem are doing at Advanced Health Network and Recovery Health Solutions, please visit ahn-rhs.com and stay tuned for our next installment of the Behavioral Health News Spotlight on Excellence series.